Jim, guess where I just got back from?
The Hebrew Rehabilitation Center, located at 1200 Center Street, Rosendale, Massachusetts, 02131?
Okay, you've heard of it?
Nope.
Well, okay then. That was a great guess, but let me tell you about their mission
The
statement.
Hebrew Rehabilitation Center, run by the Hebrew Senior Life, is a non-profit organization committed to improving the lives of older adults in the greater Boston area. They are deeply committed to transforming the way seniors live and engage with their world. Hebrew Senior Life is devoted to their ongoing mission to challenge conventions about what it means to age and to create programs that positively impact the lives of seniors.
How do you know that?
I don't know what you're talking about.
Do you know what I did there?
Why would I?
I don't know. You just keep making very specific guesses about my volunteer work.
I will let you continue with what you have to say. I'll just listen.
Thank you, Jim. Anyway, so I volunteered at the Hebrew Rehabilitation Center, where I work mainly with the elderly, ranging from their ages in 70s to even late 90s.
Did you keep them company? Go to room until you found someone who was interested in having a visitor? And then have long, meaningful conversations with them?
How did you...
Oh, I bet you loved it there. They ran a very welcoming, hospitable environment. Do you remember that journal you wrote? When you spoke with a staff person about recent changes made at the Hebrew Rehabilitation Center, and she told you that they've been improving their treatments and screening for depression. Specifically, she told you about the Making Real Progress in Emotional Health program, which provided education to primary care providers to help them better recognize depression in older patients and apply state-of-the-art treatment, training to non-clinical staff to help them recognize signs and symptoms of depression in the elderly and depression care management, DCM for short. Whew. A patient who is identified as having depression is referred to the DCM, who provided treatment including psychotherapy and sees the patient on a regular basis. I bet you wanted to ask why that was implemented. As it turns out, self-esteem issues and depression are serious health risks prevalent in nursing home settings. Yes, sirree, an estimated 26 to 43% of nursing home residents suffer from mild to severe depression in the United States.
How are you doing this?
I'm just sitting here doing nothing at all. Anyway, the reason that the elderly are so susceptible to depression, which ultimately drastically affects the self-concept, ranges from the deterioration of health, lack of economic and social resources, loss of established interpersonal relationships, and a sense of weakened control over one's life. Let's slow this down, shall we? Self-esteem can be conceptualized as self-regard and evaluation of one's worthiness. Through the little research having been done on the subject of elderly depression and self-esteem, it was discovered that feeling useful and competent is actually really important to the self-esteem of older adults.
I have nothing to say to you.
Do you want some Bronfenbrenner models?
What's Bronfenbrenner's model?
Glad you asked. Thank you very much. As you can see on this visual, there are 5 layers to the model: the individual, the microsystem, the mesosystem, the exosystem, and the macrosystem. A key concept of the Bronfenbrenner's model is a receptive layers of the environment are interrelated. They are both affect and affected by each other.
So what? What does this have to do with self-esteem and depression issues in the elderly? Not that I care, though. And why do you have a visual prepared?
Of course you care. Well, Millie, the elderly, or the individual, lives in a nursing home, which is a health service falling into the microsystem category, which includes all the various settings that the individual inhabits on a daily basis. The idea of this ecological system is that every system affects the individual, but it directly or indirectly. So, for example, in the exosystem, a system that affects but does not consist of the individual, there lies research institutions and people who contribute money to the Hebrew Rehabilitation Center. If research were to be stopped, then there would be no new ways to combat depression and self-esteem issues in the elderly. If people stopped donating money to the HRC, then these elderly folks would be living in terrible conditions and not getting the help that they need. Do you see what I mean?
Yes, I do. So in conclusion, Older adults struggle with their concept of self worth because they feel useless, like they lost control of their lives. This can often lead to depression. And, according to the ecological system presented by Bronfenbrenner, things like research and funding of the nursing home can affect the residents' mental health. Do you think there will be any way to completely curb older adults' self esteem and depression issues?
I can't say for sure. We live in a society that is gradually beginning to understand mental illness, so I think that with enough dedication, anything is possible.
I still have one final question. How do you know so much about this topic?
I don't know. It's almost like I have no control over what I'm saying and someone is moving my lips for me.